If you're over 60, doctors may not be telling you the full story. In this eye-opening video, we'll reveal the hidden dangers of walking after 60 and what you need to watch out for. Plus, if you're constantly running to the bathroom, struggling with an overactive bladder, we've got proven remedies that could change your life. Stay with us until the end to discover practical solutions that doctors don't always share. Before we dive in, don't forget to hit that like button and subscribe to our channel for more essential health updates. Walking is often praised as one of the simplest and most effective forms of exercise. It requires no special equipment, can be done anywhere, and is often recommended as a great way to stay active as we age. Doctors encourage it, fitness experts swear by it, and many people consider it a staple of a healthy lifestyle. But what if we told you that walking could actually be harming your health after 60? It might sound unbelievable, but new research and real-life experiences suggest that walking, when done incorrectly or excessively, can lead to serious health problems. And yet, most doctors won't tell you this. They assume walking is always beneficial, but the reality is that certain risks come with age, and if you're not aware of them, you could be setting yourself up for pain, discomfort, and even long-term health issues. One of the biggest concerns is joint damage. As we age, our joints naturally lose cartilage, the cushioning that helps prevent bones from grinding against each other. Walking, especially on hard surfaces like concrete or asphalt, can speed up this deterioration. If you've ever experienced knee pain, hip discomfort, or even lower back aches after a long walk, it's not just a minor inconvenience. It could be a sign that your joints are struggling to keep up with the impact. Over time, this repetitive stress can lead to conditions like osteoarthritis, a degenerative joint disease that affects millions of seniors. The problem is even worse if you're wearing improper footwear. Many seniors unknowingly wear shoes that don't provide adequate support, which can throw off balance, strain the ankles, and increase the risk of falls. This is especially true for those who have flat feet, high arches, or other foot conditions. Poor footwear can lead to plantar fasciitis, heel pain, and even nerve damage, making every step more painful than the last. And when walking becomes painful, many people start avoiding it altogether, leading to a decline in overall mobility and health. Another serious issue with walking after 60 is the risk of falls. As we age, our muscle strength, balance, and coordination naturally decline. While walking is often promoted as a way to improve stability, it can sometimes have the opposite effect. Uneven sidewalks, wet surfaces, or even a small misstep can lead to a fall that results in fractures, head injuries, or worse. The statistics are alarming. Falls are one of the leading causes of injury and hospitalization among seniors. A single fall can lead to months of recovery, loss of independence, and even long-term complications. If you've ever felt unsteady on your feet or experienced dizziness during a walk, it's a clear sign that your body is struggling with balance and may need additional support. But the dangers don't stop there. Overexertion is another major problem, especially for those with pre-existing heart conditions. While moderate walking is generally good for cardiovascular health, excessive or high-intensity walking can put unnecessary strain on the heart. If you've ever felt shortness of breath, dizziness, or an irregular heartbeat after a long walk, it's not something to ignore. Your body is signaling that it's being pushed too hard, and without proper adjustments, you could be at risk of serious complications like high blood pressure spikes, arrhythmia, or even heart failure. And here's something most people don't realize: walking can actually worsen bladder problems. Many seniors experience overactive bladder, OABA condition, that causes sudden and frequent urges to urinate. But how does walking fit into this? More than you might think. The impact of walking, especially on harder surfaces, puts subtle pressure on the bladder, making urgency and leakage worse. This is particularly true for those who already have weakened pelvic floor muscles, a common issue as we age. If you find yourself rushing to the bathroom more often than before, or experiencing leaks during or after a walk, it could be a sign that your bladder health needs attention. An overactive bladder can be more than just an inconvenience. It can seriously affect your quality of life. The constant need to find a restroom can make outings stressful, limit travel, and even disrupt sleep. Many people with OAB start planning their entire day around bathroom access, avoiding long walks, social gatherings, or even skipping hydration altogether in fear of frequent urination. But this strategy often backfires. Dehydration can make urine more concentrated, irritating the bladder even more and worsening the problem. So what can be done? Thankfully, there are proven ways to manage EAB and improve bladder control without resorting to extreme measures. One of the most effective methods is strengthening the pelvic floor muscles through targeted exercises. Kegels are a simple yet powerful way to regain bladder control. To do them, contract the muscles you would use to stop urination midstream, hold for a few seconds, then release. Doing this regularly can make a significant difference over time. But consistency is key. Like any muscle, the pelvic floor needs regular exercise to stay strong. Diet also plays a crucial role in bladder health. Certain foods and drinks can irritate the bladder, making OAB symptoms worse. Caffeine, alcohol, spicy foods, carbonated drinks, and acidic fruits like oranges and tomatoes are all common triggers. Reducing or eliminating these can help restore balance and reduce sudden urges. Instead, opt for bladder-friendly foods like bananas, oatmeal, lean proteins, and fiber-rich vegetables that support digestive and urinary health. Another technique that has been shown to work is bladder training. This involves gradually increasing the time between bathroom visits to help the bladder hold urine for longer periods. Instead of running to the restroom at the first urge, try delaying it for a few minutes. Over time, extend the interval to retrain your bladder's response. This simple practice can significantly reduce the frequency of urgent trips. Supplements can also be an effective addition to a bladder-friendly routine. Pumpkin seed extract has been found to strengthen bladder muscles and reduce nighttime urination. Magnesium is another key nutrient that helps relax bladder muscles and prevent spasms. Before starting any supplement, it's always best to check with your doctor, but these natural remedies have helped many people regain control over their bladder health. In some cases, medical intervention may be necessary. If natural remedies and lifestyle adjustments aren't providing enough relief, doctors may prescribe medications that help calm bladder activity. For those with more severe cases, physical therapy or minor surgical procedures can be considered. The key is to seek help early rather than suffering in silence. Walking, when done correctly, can still be a valuable part of a healthy lifestyle. The key is to make adjustments that protect your joints, balance, and bladder health. Choosing the right footwear, walking on softer surfaces like grass or rubber tracks, and taking regular breaks can help reduce strain on your body. If you experience pain or discomfort, listen to your body. Pushing through the pain can lead to long-term damage. Instead, consider lower-impact alternatives like swimming or cycling, which offer cardiovascular benefits without the same level of impact. For those with balance concerns, using walking aids like trekking poles or stability shoes can provide additional support. Practicing strength and flexibility exercises can also enhance stability and reduce the risk of falls. Yoga, Tai Chi, and resistance training are excellent ways to build muscle strength and improve coordination. Ultimately, the goal is to stay active while minimizing unnecessary risks. If you're over 60, being mindful of your joint health, balance, and cardiovascular limits can help prevent complications. And if you're dealing with an overactive bladder, remember that you're not alone. There are proven solutions to regain control and improve your daily life. If this video helped you, make sure to hit that like button and subscribe to our channel for more health tips that can keep you feeling your best. Turn on notifications so you never miss an update on how to stay healthy and active. Your health is in your hands, so take the steps today to ensure a happier and healthier tomorrow. Thanks for watching.